Hello and welcome again. This is Alexander Bird and the Peter Sowerby Philosophy and Medicine Project at King's College London with our third video podcast on epidemiological modelling. Today I want to talk a bit about the government's COVID-19 strategy and to ask really what it is. We know surprisingly little about the government's strategy for dealing with the COVID-19 crisis and extricating us from that crisis. We know what the government wants us to do in terms of social distancing, and we know what it is now doing in terms of building those nightingale hospitals, trying to procure PPE, ventilators, and finally doing some large-scale testing. We know that those things will help slow the spread of the disease and help those who've contracted the disease. But what overall plan for managing and resolving the crisis does all this serve? There are two broad strategic directions that the government could go in. These are suppression and mitigation. Suppression means trying to eliminate the disease altogether. It means doing our utmost to ensure that there is no transmission. It requires a very stringent lockdown and involves assiduous testing and contact tracing to capture any possible further infections. Several East Asian countries have attempted suppression with apparent success. Suppression is most likely to be effective, of course, if attempted early on in an outbreak. Now, clearly, suppression isn't the UK's strategy at present. Not only did it not pursue lockdown early enough, it isn't pursuing it vigorously enough now, given the relative dearth of testing, to have any chance of achieving suppression in the short or even medium term. So the government is clearly considering relaxing the lockdown to some degree, and that's going to happen before the disease is eliminated. So clearly suppression is not the strategy that the government is currently following. Nor for that matter do I think that it should be. Achieving suppression is one thing, but maintaining it is another. As soon as the stringent suppression measures are relaxed, then there's a very high chance that the disease will return, whether from sort of hidden pockets within one's own country or brought in by travellers from outside. And Hong Kong, which did have a very effective suppression strategy, its measures did get the disease largely to be eliminated, nonetheless is experiencing just this, that having achieved suppression relaxes its measures and the disease comes back. So one would have to keep this very high level of lockdown and surveillance in order to achieve suppression. And for how long? The question. Well, until a vaccine is found, but that will be many, many months away. So suppression, if it's to avoid a second wave or a third or a fourth wave, means vastly reduced freedom and therefore economic activity for months on end. So our government clearly isn't going to contemplate that. It's not as if this is a question of lives or the economy. You've got to choose between the health of the economy or health of people, because the negative health effects of unemployment, increased poverty, reduced taxes and services are demonstrable. So it's a very real health choice as well. So the second alternative strategy or strategic direction, because there could be many detailed ways of implementing it, is mitigation. So this policy accepts that COVID-19 will continue to spread in the medium and possibly even the long term. Its aim isn't to eliminate the disease altogether, but principally to mitigate its worst effects. Now, its worst effects clearly are the deaths of people. And what fuels mortality are two causes. Infections of the elderly and otherwise vulnerable, people with underlying health conditions, as it said, comorbidities, the the technical term, being sick in other ways other than catching the disease. So those are the vulnerable people, and their catching the disease is a major factor, of course, in the mortality figures. The second contribution to mortality figures is the lack, inadequate hospital care, most obviously through health services being overwhelmed with cases, unable to give them each the best care that they normally would be able to provide. So the primary aims of any mitigation strategy must be, firstly, to protect the vulnerable, and secondly, to ensure that the capacity of the NHS exceeds the number of people needing a hospital bed and intensive care. So we have measures that are aimed to do precisely this. We have a lockdown that reduces the rate of spread of the disease and hence reduces the growth in demand, while additional lockdown rules protect the vulnerable in particular. The building of the Nightingale hospitals, the scramble to produce ventilators, the recall of retired doctors and nurses, and so forth, are all aimed at increasing the capacity of the health service to deal with the very sick. Testing and tracing are not key components of a mitigation strategy, although they can help it, which explains why our government has been slow to test up until this point. It's got other priorities given a mitigation strategy. Let's imagine that the mitigation strategy works in that the vulnerable are protected and our hospitals are operating with spare capacity. What then? Well, it's important to note that this strategy does accept that the virus will continue to spread. There will be more infections, and in due course, a large proportion, possibly even the majority of the population, will have been infected. The aim of the strategy is to ensure that these people won't include the vulnerable, and if there are, and the people who do get sick are given adequate treatment. The NHS has the capacity to treatment. But of course, even so, there will be deaths with this strategy. Since the motivation for this strategy, rather than suppression, is the acceptance that the worst economic and social ill consequences of COVID-19 must be avoided, a relaxation of the lockdown rules will follow. But how quickly should they be relaxed? Not so quickly as to threaten the capacity of the NHS, of course. On the other hand, and this might seem strange, there are reasons to want to avoid reducing the infection rates too much. This is not just for economic reasons. Once one accepts that there will continue to be widespread infection, such that a large proportion of the population will eventually become infected, then it makes sense to have those infections sooner rather than later, subject always, of course, to the capacity of the health service. If at some point in the future people are going to be infected and some of them hospitalised, it makes no sense for them to be cooped up at home inactive waiting for that to happen while the Nightingale hospitals are still only half full. It would, on this way of implementing the mitigation strategy, be better to relax the lockdown sooner and bring forward those hospitalisations. If lockdown and social distancing rules were a kind of valve that could be precisely adjusted, which of course isn't the case, but if they could be precisely adjusted, then one plausible high throughput strategy or approach would aim to relax those measures just enough to fill the hospitals to near capacity. This approach aims precisely to flatten the curve. The daily infection rate stays at the same level for an extended period before declining. Whereas suppression, on the other hand, aims to put the infection rates into immediate and sharp decline. Isn't this just the herd immunity policy supposedly supported or proposed by Dominic Cummings, who then valiantly got himself infected in support of that aim? Well, the government has said that herd immunity is not the goal of this strategy, but is a helpful byproduct. I've talked about this in another of these videos. Sir Patrick Vallance talked of 60% of the population being infected. That might be misleading, since 60% is the proportion that would need to be vaccinated in order to prevent an outbreak taking hold. But an epidemic that is left to run its course on its own without any protective measures is a different matter. So without protective measures, 60% infection levels is the point at which the epidemic will go into decline, but around 90% of the population would have been infected before the epidemic finally dies out. And that will also mean probably hundreds of thousands of deaths. So whether at 60% infected or 90%, aiming for herd immunity with no mitigation could never have been a reasonable policy. Even the high throughput approach to mitigation I described a moment ago could lead to a substantial number of deaths. And these would be concentrated relatively early in the epidemic with high daily numbers of deaths. So one might expect the politicians to adopt something that looks a bit like a mixed strategy that is fundamentally one of mitigation, but has elements that look a bit more like suppression, such as testing and tracing. Reducing the infection rate to well below NHS capacity would reduce daily death rates and may reduce the total number of deaths throughout the population. But of course it would extend the period of depressed economic activity. Why is the government not clear about its strategy? Many people have been complaining that it hasn't really articulated what its strategy is and what in particular its strategy is for getting us out of the crisis that we face, the exit strategy. First, it might be that the government isn't entirely clear in its own mind about which version of the mitigation strategy it's going for the high throughput approach that I described, or something of a more mixed approach, something with an element of suppression about it as well. Secondly, if the high throughput version is the strategy adopted, it would be unpalatable to tell the public that it actively wants the hospitals to be largely full. Thirdly, the mitigation strategy in any form doesn't fit well with the rhetoric of defeating the virus. Defeating the virus is what suppression aims to do. Mitigation sort of accepts it's going to be a part of our lives for some time. For those who like the military metaphors, mitigation is more Dunkirk than Normandy. And finally, being clear that it is expected that a large proportion of the population will get the illness raises the risk that many individuals won't stick to the restrictions required to manage this mitigation strategy. So the lockdown and observing social distancing rules and so forth is important as part of the mitigation management strategy. But if people think, well, I'm going to get this disease anyway, they may not observe those rules, those requirements as stringently as needs to be the case. Compliance is clearly a major concern for this government. Given all this, it seems to me that it's no surprise that the government isn't keen on being clear about its mitigation strategy, let alone what kind of exit we should expect. Anyway, thank you very much for listening. Do remember to visit philosophyandmedicine.org for more of this kind of content.